Well, it's that time of year again. Yeah, I know it's fall, and that means lots of different things, but it also can mean this. Just a little something I got in the mail the other day. And lots of reading material here. But if you're like me, you probably just got this, put it down, and said, all right, I'll get to it. So this really means one thing. We're heading into Medicare Open Enrollment, and that's what we're going to talk about today. Some people say there's nothing more confusing than Medicare. I tend to agree. But that's exactly why you need to tune in so we can demystify it for you, okay? Stay tuned. Good morning, everyone, and welcome to Scan FYI. How is everyone out there and wherever you're listening from? We appreciate it. So as I said, it's that time of year. It's getting ready for Medicare Open Enrollment. And my guest today is none other than Lauren Feldman from Horizon Blue Cross Blue Shield of New Jersey, also Brave in Health. Lauren, thanks for being my guest today.
Thanks for having me.
A pleasure. You know what? Why don't you just tell everyone a little bit about yourself? What is your role at Horizon? And then we'll kind of get right into it.
Okay, sounds good. So as Andrea said, my name is Lauren Feldman. I am a community events coordinator with Horizon Blue Cross Blue Shield of New Jersey, also for Brave in Health, which is the new company that's in partnership with Horizon, Hackensack Meridian Health, and Robert Wood Johnson Barnabas Health. So I support that as well. I've been with Horizon for 6 years. I started as a call center service associate. Then I moved to a community health representative and now a community events coordinator. But I also have my sales license, which allows me to talk about Medicare, to help people find their plans, and to discuss different benefits during the annual enrollment period. So I'm very happy to be able to talk about this. I know that it can get very confusing, but that's why we're here to kind of break down the different parts and really make it as simple as possible for everyone to understand.
So first things first, we're going to start and end with this. The dates for open enrollment. And by the way, all Lauren's contact info and the open enrollment info, I'll put that in all my comments. But Lauren, what are these open enrollment dates for folks?
So it is October 15th to December 7th, and that would be for your plan that will be going into effect as of January 1st, 2022.
2022. I got my book. I'm sure you all did out there too if you're on Medicare. All right. Well, you know what? First things first, because I think a lot of people, some of you are already on Medicare. Some of you might be just getting ready to be in Medicare. And maybe some of you have parents that are just getting into Medicare. So Lauren, just a brief overview. What is Medicare?
So Medicare is a federal health insurance program. It is for people who are over the age of 65, but it also provides coverage for people who are under 65, but they have certain disabilities. It provides you with some inpatient and outpatient coverage, but the thing with Medicare is that it only covers 80% of the costs. That's talking about original Medicare. So that's that Part A and Part B, which is why a lot of people choose to get some other coverages to help kind of fill those gaps, which we can talk about today. And a lot of people get this confused with Medicaid. Medicare is different than Medicaid, where Medicare is driven by age, Medicaid is driven by income, and it's different from state to state. Medicare is run by the federal government, and it provides you with that inpatient, outpatient medical coverage, and it is based on age.
You know what I want to mention is that some people might be on the false assumption that this is an automatic process, Lauren, that you hit 65 and you're on Medicare, but you have to sign up for this. You have to, right. So just mention kind of there is a process here.
Yeah, so there is a process. I can also go over like when you should start preparing for this, when you should plan. Also, it's going to be different for everyone. That's the thing about Medicare too, is it's really unique to your own circumstances. So some people may work past 65. A lot of people are doing that now. So your timeline may be a little bit different than even your spouse or maybe your neighbor.
Right.
It's really going to be unique to you. But in the general situation, you do need to sign up for Medicare Part A and you need to sign up for Medicare Part B. And you want to make sure that you're aware of all of your choices. You want to really look around and understand the different options that are available to you. And you want to choose a Medicare plan that best fits you individually.
Right. And that's why you don't necessarily want to consult with your brother-in-law, your spouse, your BFF, because as Lauren said, it's for your unique circumstances. And I think it's fair to say if you got 10 people together, each one of them would have a different set of circumstances. So it is not a one size fits all.
Definitely.
All the more reason it's in your best interest to consult with a Medicare advisor, just so that you have a good understanding of, what is actually out there.
Mhm.
And so even if you're still working, Lauren, you can still be participating in Medicare. It has nothing to do with that.
Yeah, so this is going, again, to depend on your specific circumstances and your employer. So if you are still working, you might be able to defer signing up for Medicare. So the best route of action that you can really take to figure out if you do need to sign up when you turn 65 is to talk to your employer or to your union group benefits administrator, whoever is in charge of those things, and you want to see whether or not they require you to sign up for Medicare. And that's usually going to depend on the size of your employer. But human resources, your employer, your benefits administrator, they'll have all of that information for you. So that's a great first place to start if you are still working. If your employer doesn't require for you to sign up right away, then there's nothing that you would need to do at that time until you either retire or lose that group coverage. So
So
that's a good place to start.
as you're becoming 65, or maybe you are 65 now, what is the timeline for people to understand about when you need to be signing up for this?
Okay, that's a great question. So when you're first eligible for Medicare, you have a 7-month time slot, and that is called the initial enrollment period.
All right, so that's a big window, 7 months.
Yes, it is. So that's another thing that gets a little bit confusing with Medicare is there's all these different names for the enrollment periods. Like coming up, we have the annual enrollment period, and that's again every year, October 15th to December 7th. The initial enrollment period is when you are first eligible. So that's when you're turning 65. So this 7-month window revolves around your 65th birthday.
Okay.
So it begins 3 months before your birthday. It includes the month of your birthday, and it ends 3 months after your birthday. So we really advise people to start this sooner rather than later, just so that everything's straightened out and ready to go before this window closes.
Yeah.
So really, you can really start looking into this even when you're 64, just so you have a good idea of how everything works. But really, at least 3 months before your birthday, you want to start seeing all your options and deciding what it is you're going to do.
Now, Lauren, what happens if you turn 65? For whatever reason you missed that initial enrollment period, and it's now a year later, months later. What's the process now? Is there a penalty?
Yeah, so that's another great question. So this is another reason we stress that you really want to pay attention to your circumstances and when you should be enrolling. So for most circumstances, if you don't sign up for Medicare, this is for Part B specifically. Part A is what you're usually automatically enrolled into when you turn 65, and that's based on having worked 10 years or 40 quarters over your working life. Part B is the one that drives everything, and this is the one that you really need to sign up for. That's where I talk about that initial enrollment period in the 7-month window. So if you do delay signing up for Medicare Part B, in most cases, again, there's always special circumstances, you will have to pay a late enrollment penalty. And the thing with this late enrollment penalty is you're going to keep paying that penalty for as long as you have Part B.
Really?
And a lot of people don't realize that. So they think maybe it's a one-time thing. I don't need Medicare right now, whatever, I'll just wait till I do. then you decide to enroll in Part B, you think maybe I'll just pay this one-time late fee, but it's actually a percentage of that Part B premium, and you are going to pay that for as long as you have Medicare Part B. So that's why it's really important.
Yeah, for sure. Because that's a serious penalty. If it's a one-time thing, but forever and ever, wow, that's
Yeah, and the longer you wait, the larger that penalty is going to be.
all right. So all the more reason you need to investigate this way in advance, not the day of your birthday. You're right about that for sure. Now, there's obviously open enrollment. Let's just get into that a little bit more, because open enrollment happens every year.
Yes.
And every year we talk about it. And what is the purpose? Because you're already on Medicare. You've already signed up. And now every year is this open enrollment. So just kind of talk a little bit about what is that exactly?
Yeah. So again, that's that period that we said from October 15th to December 7th. And that's your chance to really evaluate your current situation. So you can sit there, even if nothing's wrong with your plan, you're very happy with it, you still might want to just make sure your circumstances haven't changed. Maybe you're on more medications now. You want to make sure that those are all covered. Your doctors, you want to make sure that they're still participating, depending on the type of coverage that you have and if that applies to you, which we
Right.
can talk about as well. And it can never hurt to really just look around and make sure that the plan that you're on is still your best option. And plans do change from year to year, depending on, again, the type of Medicare coverage that you've chosen. And you just want to make sure that everything is still working best for you. You never really want to feel like you're stuck. You just want to make sure that you're doing everything that's in your best interest. And
So
that's a great time to reevaluate that.
it's the one time of year when I think it's a good opportunity to go through your plan and make sure it's still working for you. Because as you said, your medical situation can change. So many things can change. Your plan changes. Your plan might get tweaked a little bit every year. Maybe the medication that you're on now or we're on, maybe it's not covered anymore or at a different percentage. So
yes,
if you don't take advantage of the open enrollment, I don't like to say you're stuck, but you are stuck now for another year.
Well, there actually are a few other enrollment periods. So this is kind of related to what I was saying before. That's not your only time. So the initial enrollment period, that's IEP, as I said, that's around the time when you're first turning 65. So that's that 7-month window. The annual enrollment period is the October 15th to December 7th. That happens every year and allows your coverage to start January of the following year.
Right.
Then there's also a general enrollment period. So that's the GEP. And this is for if you did not sign up during your initial enrollment period. So that's when you first turn 65.
Yeah.
And you don't qualify for a special enrollment period, which is something else I can talk about. You have what's called a general enrollment period from January 1st to March 31st each year. But the thing about this is your coverage would not be effective until July of that year.
Ooh.
And you may have a higher Part A and Part B or Part D premium for that late enrollment. So that's if you didn't sign up during that initial enrollment period. You have from January 1st to March 31st, and your coverage is not going to go into effect until July. And that late effective date is kind of just to not encourage people to wait and just rely on, I didn't need it, I'm going to wait until I'm sick, or I need the coverage. You want to kind of really be prepared ahead of time and get that coverage the year prior so that it starts January 1st. You don't have any gaps in your coverage, and you'll have that Medicare coverage right away the following year.
Right. That's really important, because otherwise, you're sort of rolling the dice that nothing is going to happen to me. But, life just isn't like that, as I think we all figured that out recently.
Yes.
All right. So there's different parts to Medicare. I mean, I still find it confusing, even though working at SCAN, fortunately for me, I get to meet people like Lauren, and we always do presentations really every year because there's no end to the confusion, which is unfortunate. But again, that's why we're doing this right now. So there's different kinds of Medicare plans as well. And let's talk a little bit about that. And then there's something called an Advantage plan. So
Yes.
let's cover that a little for people.
Okay. So just to briefly say what the different parts are. So to break it down in the simplest way possible, because again, it's a bunch of letters, part A, B, C, D, and people get confused. So to simplify it, you can start with original Medicare. So that's when you have your red, white, and blue card with an effective date. This is parts A and B. So part A is your hospital coverage. Part B is your doctor coverage or anything done outside of the hospital. So A and B, that's that red, white, and blue card. That is original Medicare. Again, Part A, you usually are automatically enrolled in if you've worked at least 10 years or 40 quarters.
Mhm.
And for the most part, you don't have a cost for Part A. Again, there's always some unique circumstances. Some people may have to pay, but the most general scenario is you do not have to pay for Part A. Then Part B, that doctor coverage, usually always has a premium associated with it. And it's a set annual premium. It's standard across the board. It's typically the same, except it is based on income. So certain people with much higher or much lower incomes may pay a little bit of a different Part B premium than others. So again, that's your basic hospital doctor coverage, but original Medicare only covers 80% of costs. So this causes a lot of people to say, well, I don't only want to be covered 80%. What about that other 20%? Because there is usually a deductible associated with Part B or original Medicare as well. So this causes a lot of people to get a supplement plan, which is also known as Medigap or Medicare supplement. So you can think of this as that part that kind of fills that gap or that remaining 20%. So when you purchase a Medicare supplement plan, this is through a standardized plan. So whether you get it through Horizon or another carrier, it's going to be a standardized plan. So they're going to be the same across the board. The only thing that's going to differ is the cost for these plans. And the thing with these Medicare supplement plans is they allow you to go to any doctor or hospital in the country who accepts Medicare. So the benefit with taking this route, you have the coverage, that 20% coverage, and you have the freedom to go to any doctor who accepts Medicare. So there's always kind of a give and take with these different Medicare options. So with the Medicare supplement, you have that freedom, that great coverage to go basically anywhere you want that accepts Medicare. But these plans typically do cost a little bit more, say compared to Medicare Advantage, which we'll talk about. And you also have a separate premium for these plans. So you'll have your Part B premium. Now you'll also have a Medicare supplement plan premium. And this does not cover prescriptions. So if you wanted prescription coverage, you would also need to purchase a Part D plan. So you now have 3 different things that you're separately paying for.
That's right. It's like 3 different insurance policies. I'm glad you mentioned that. Yeah, that's something right there. Yeah.
So that's something to think about. Again, you want to think about what works for you, what's most important in your scenario. Do you want to have the freedom to see all of these doctors that accept Medicare, but you want to pay a little bit more? Or do you want to, have a different type of plan that maybe covers everything all together, which we can also talk about. So again, with these Medicare supplement plans, they help to cover those Part A and Part B deductibles. They'll also help to cover those copays and coinsurance that might come with original Medicare. They'll cover foreign travel emergencies and additional hospital days. Again, it depends on which plan you select. There's all those different letters. That's where you hear Medicare Plan J, K, all of those. Those are those Medicare supplement plans.
Yeah.
And that's not to get confused with the Part A Part B, and Part D.
Oh, I'm sure nobody's confused.
Yeah, it definitely gets a little confusing. So that's why I'm trying to break it down. So the other part I want to talk about before we talk about Medicare Advantage is Part D, and that is your prescription drugs.
Yeah. It
That
can,
one at least is a little bit
that
easier to
gets
remember. Part
well,
D,
I think of
drugs.
D for drugs, but that is, I find, one of the most difficult parts of the whole thing. And remembering too, the original the original plan is 80%. And some people might say, well, 80%, that's pretty good. But medical costs and drugs and whatnot being what they are, 80%, that 20% can still be huge.
That's a great point. And it's also great to note that there's no cap on that 80%. So that's just whatever the costs are, how many times you go to the doctor, it's always going to be you have that 20% liability plus any cost sharing that might come along with original Medicare.
And that 20% can be a really tremendously astronomical number if something should happen to you. Yeah. All right. So yeah, explain.
Definitely.
Drug plan.
Yes. So Medicare Part D, the prescription drugs. So this is not included in original Medicare. It's not included in Medicare supplement. So if you take that route of either just keeping original Medicare, the 80%, or even adding the Medicare supplement to fill those gaps, if you want prescription drug coverage, you would need to purchase Medicare Part D. And this is only available through private insurance companies such as Braven Health. And these plans are going to differ based on where you live. And the drugs are typically listed on a formulary with 5 tiers. So
again,
this is a whole
whole
another part to this, which is really important to look into. So one of the main things that you want to make sure of when you are selecting a plan is, are your prescription drugs covered?
Right.
That's a huge thing. Another thing to note is maybe when you first enroll, you're not taking any medications or there's no prescriptions that you need, and you say, I'll get the Medicare coverage, but I'm going to just let the drug coverage go for now because it doesn't apply to me. You want to note that there is also a late enrollment penalty with Part D with those prescription drugs. And you may have to pay that late enrollment penalty if you do push off getting that drug coverage in your initial enrollment period. Again, that's that 7-month window around turning 65. And this is also going to be a cost that stays with you for as long as you have Medicare. And the cost is going to be higher depending on how long you actually wait to get Medicare Part D.
All right. I think there's one thing that I hope is becoming very apparent to you out there listening. Do not delay. Sign up for it, during your window, get your research done in advance so that you're ready to go. And why should you have to get stuck with a financial penalty when it's so unnecessary?
Mm-hmm.
Lauren, if you would briefly explain what an Advantage plan is, and then we'll just remind, as we close, we'll just remind people about a few things, but it's important to mention the Advantage plan.
Yes, definitely. So this is that final option we haven't discussed yet. So we talked about the one route, original Medicare. You can add on a supplement plan, and then you can also add on prescription drug coverage. So you kind of have freedom to go wherever accepts Medicare, but you have all of these different types of cards and premiums. So Medicare Advantage, this is also known as the Medicare Part C, is kind of your all-inclusive coverage. So it's going to include all of the benefits of Medicare Part A and B. It also typically offers prescription drug coverage included in this plan, plus additional benefits that are not offered under other plans, which could be dental, hearing, or vision, which original Medicare and supplement plans do not offer. So the thing about these plans is they may require you to use a specific network of doctors. So this is kind of that give and take again that I have discussed.
Right.
These typically have very low premiums. A lot of plans even offer $0 premiums. So you're always going to still have your Medicare Part B premium, if that applies to you. But if you choose a Medicare Advantage plan, this could be a lower cost option for you with also getting some additional benefits. So again, the dental, vision, hearing, plus now you only use one card. So you can put your original Medicare card away, that red, white, and blue, keep that somewhere safe. You don't have a separate card for your prescription drugs. It's all on one ID card, which is what I think a lot of people are more familiar with, having group coverage or coverage through your employer. You just have that one card. This is very similar to that. So your prescriptions, everything's just all in one for you.
Right.
These plans may require you to pay co-payments, co-insurance, or some deductibles, some out-of-pocket cost sharing. It's going to depend on the plan you choose, again, through a private insurer. So just brave in how much these costs are going to be. So that's why it's really important to shop around and compare. Make sure, again, that your drugs are covered under these plans, that your doctors are in network. That's a huge thing, and that the costs and everything make sense for you.
Wow. I want to say, is that all? Oh my God. Your head.
I know, it is a lot.
It really is enough to make your head spin. But the most important thing that I want to remind everyone, open enrollment, October 15th through December 7th. Again, we'll put this in our comments. Don't delay. Don't get stuck with a penalty. It's totally unnecessary. Shop around, because just because this works for me doesn't mean it's going to work for you. As Lauren said, every one of us has a unique circumstance. I will also put some information about Medicare counselors, because again, they have no skin in the game. Their one and only job, free, is to advise you what are the differences are in the plans, help you figure out what's best for you. We'll also put Lauren's information if you want to reach out to her as well. I think this is a really important topic for everyone, whether you're on Medicare, whether you're getting ready to be on Medicare. If you know someone who's on Medicare, it's confusing. And I hope also that we were able to demystify it at least a little bit for everyone. I hope so, Lauren.
Yes, I hope so too. Another great place to start that I just want to point out, Medicare.gov. They
Yes.
have a lot of good resources on there just for figuring out the different parts, kind of some steps to walk through. Anytime you have a question, you can really just type it into their search bar and get a bunch of results. So I think that's a great thing to just kind of keep in your back pocket and refer to.
I'll put that link in the comments too, because I agree with Lauren. Medicare.gov, it is a good website for, it's a good starting point.
Mm-hmm.
All right. Well, Lauren Feldman from Horizon Blue Cross Blue Shield of New Jersey and Brave in Health, thank you so much today for being my guest on Scan FYI.
Thank you again for having me.
Okay. Remember out there, if it's important to you, it's important to us. I'm Andrea Tarr, and we'll see you next time on Scan FYI. Bye, everyone. Bye, Lauren.
Bye.